Okay, let's unpack this. Today, we're doing a deep dive into a really important topic for, well, anyone with a pet, really.
Hmm.
We're talking about understanding cancer in pets.
Hmm.
We've got this great source material here, Understanding Pet Cancer, and our mission basically is to pull out the key insights for you.
That's right. It's a heavy subject, no doubt, but definitely an essential one. The source makes it really clear that cancer is, well, unfortunately, a major health issue for our companion animals.
Yeah.
Pets are living longer these days, which is fantastic, thanks to better vet care overall. But that also means cancer is becoming one of the leading causes of death, especially in older pets. So, yeah, understanding it is crucial.
Absolutely. So maybe diving right in at the most basic level, when we talk about cancer in, say, dogs and cats, what's actually like happening inside their bodies?
Okay, so at its core, cancer is really a disease of uncontrolled cell growth. It's basically when abnormal cells just start multiplying,
Okay.
dividing, without stopping, and they can invade the tissues around them.
So you end up with these like clumps of abnormal cells, which we often call tumors.
Exactly, tumors. And this is a really important distinction the source brings up. Not all tumors are cancerous. That's key.
Oh,
Tumors can be benign. That means they're non-cancerous. They generally stay put, don't spread. Or they can be malignant, and that means they're cancerous.
right.
The real hallmark of malignant tumors is that ability to invade other tissues and, critically, to metastasize.
Metastasize, spread to other parts of the body.
Precisely, spread to distant organs. That ability to metastasize is what makes malignant tumors so dangerous. They're not just, a local problem.
Gotcha. That makes sense.
And it's important to remember it's not just one single disease. The source really emphasizes this. Cancer in pets, just like in people, is actually a whole group of related diseases.
Mhm.
It can show up in many different forms, affect pretty much any part of the body, skin, bone, blood, internal organs, you name it, which is why diagnosis can be so varied, you see.
Yeah. That context really helps. So, okay, how common is this then among our pets?
Right.
What are the numbers like?
The statistics are pretty striking, actually. They really underline why we're talking about this. The source, it cites groups like the Animal Cancer Foundation, says that approximately 1 in 4 dogs will develop cancer at some point.
1 in 4. Wow, that's significant.
It is. And get this is even more striking. Almost 50%, half of dogs over the age of 10 will eventually be diagnosed with some form of cancer.
Half of older dogs. Wow.
For cats, it's generally less common than in dogs, but still, a very significant concern.
Okay, that statistic alone really makes you realize how prevalent this is. So given those kinds of numbers, what are the main factors that put a pet at higher risk?
Well, the main risk factors listed pretty much mirror what we often see with cancer in lots of species, humans included. Age is a huge one, definitely. Older animals have just, had longer exposure to potential environmental things, and their cells have accumulated more damage over time. You can kind of think of it like the cellular machinery getting a bit less efficient at fixing errors as it gets older.
Like the wear and tear of life, but on a cellular level?
Exactly that. Wear and tear. Breed also plays a really big role.
Genetics.
Genetics, yeah. Predispositions. The source gives some specific examples, which is helpful. Breeds like, say, golden retrievers and boxers. Unfortunately, they have higher rates of certain cancers, like lymphoma in Goldens or mast cell tumors, often in boxers.
Right. Okay, so age and genetics are big ones. What else influences the risk?
Environment is definitely a factor. Exposure to things like secondhand cigarette smoke, certain pesticides, herbicides, even some industrial chemicals can increase risk. Diet is also mentioned. Maybe not always a direct cause, but poor quality or unbalanced diets might contribute to chronic inflammation, and that's been linked to some cancers over time.
So their lifestyle, their surroundings,
Yeah.
it really does matter.
It absolutely does. And one more thing. Hormonal status is important too. Unspayed female dogs have a significantly higher risk for mammary tumors, breast cancer, essentially.
Okay.
And in certain breeds, intact males might have a slightly higher risk for testicular cancer.
That definitely highlights a benefit of spaying and neutering then for
Yeah.
preventing certain cancer types.
Do sure.
Okay, shifting gears a bit. Let's talk about the specific types of cancer our pets are most commonly diagnosed with. What does the source material highlight there?
Sure. So in dogs, some of the most frequent ones include lymphoma that affects the lymphatic system, the immune system cells, often shows up as like enlarged lymph nodes you might be able to feel.
Okay.
Osteosarcoma is another common one. That's an aggressive bone cancer, particularly common in large and giant breed dogs. Hemangiosarcoma, that's a scary one. It's a cancer of the blood vessels, often found in places like the spleen, liver, or heart, and it can grow very, very fast.
Those all sound quite serious.
They certainly can be. Also common are mast cell tumors. These are skin cancers, but they can range quite a bit from relatively benign to highly aggressive.
Okay.
And melanoma, often found in the mouth or sometimes on the skin, which can also vary a lot in how it behaves.
What about for cats? Is the list different for our feline friends?
It is, yeah, somewhat different. For cats, lymphoma is also the most common cancer. But interestingly, the source notes it's often associated with the feline leukemia virus, FLV, which is why testing for FLV and prevention, like vaccination where appropriate, is so important.
Right.
Squamous cell carcinoma is another big one in cats. It's a skin cancer, often linked to chronic sun exposure, especially on the ears or nose of white or light-colored cats.
Makes sense.
Mammary tumors in cats are particularly concerning because the vast majority, something like 85–90%, are malignant, especially in unspayed females.
Why?
Yeah. And fibrosarcoma is another one that's a connective tissue cancer that can be pretty aggressive and sometimes challenging to treat.
That's a lot of specific names and types.
Yeah.
So maybe bringing it back to the pet owner, with all these possibilities, different locations, what should we actually be looking out for? What are the warning signs?
Yeah, this is probably one of the trickiest bits for pet owners, honestly, because the symptoms are just so varied and often really nonspecific. The source lists several common signs, but, many of them could point to other things, less serious issues too. This is why just being vigilant is so key.
Okay, so what are some of those common but maybe kind of vague signs?
Unexplained weight loss is a big one, or a loss of appetite that persists. You might notice lumps or bumps, obviously, anywhere on or under the skin, especially if they're new or growing or changing.
Okay.
Wounds that just don't seem to heal properly, lethargy, just unusual tiredness or unexplained weakness.
And things like lethargy, weight loss. They could just be signs of a pet getting older, couldn't they? How do you know when to really be concerned?
That's the challenge, exactly. That's why it's tricky. Other signs could be difficulty breathing, coughing, changes in urinating or defecating habits, straining, blood, frequency, persistent lameness, maybe, or other signs of pain, bleeding, or any unusual discharge from, any body opening, or even just noticeable changes in their behavior, their normal activity levels.
Right.
The core message, really, the insight from the source here is any persistent or unusual change in your pet's health or behavior warrants a vet check.
Okay.
Don't just automatically write it off as, oh, they're just getting old. Your vet is the best person to sort out if it's something minor or potentially serious.
That's really great advice. Trust your gut, basically, and get it checked out. Better safe than sorry.
Exactly.
So if you do notice something concerning, you go to the vet. How do they actually figure out if it is cancer? What's the diagnostic process look like?
Diagnosis usually involves several steps to get a really clear picture. It nearly always starts with a thorough physical exam. The vet will feel carefully for any masses, enlarged lymph nodes, other abnormalities.
Okay, the hands-on check.
Yep. Then diagnostic imaging is often the next step. Things like x-rays, ultrasound, maybe even CT scans or MRI in some cases. These help assess the size, the location, and importantly, the potential spread the metastasis of any suspected tumor.
So imaging lets them actually see what might be going on inside.
Right. But to know for sure what type of cancer it is, and critically whether it's malignant or benign, they usually need a sample, cells, or tissue.
Okay.
This could be something called cytology. That often involves using a fine needle, like a really thin needle, to suck up some cells for examination under a microscope. Fine needle aspirate, or FNA. Or it might be a biopsy, which means surgically removing a small piece of the actual tissue for a pathologist to analyze in more detail.
Okay, so cytology is looking at the individual cells, maybe while a biopsy looks at the whole tissue structure. Is that roughly right?
That's a pretty good way to think about it, yeah. A biopsy generally gives a more definitive diagnosis, and it can also often tell the vet the grade of the cancer, basically how aggressive it looks under the microscope, which helps predict how it might behave. They'll also usually run blood tests, other lab work, check organ function, assess the pet's overall health. All of that is vital for planning any potential treatment. Getting that diagnosis right and getting it in a timely way is absolutely key. It dictates the best treatment path and really influences the prognosis, the outlook.
That makes complete sense. The right diagnosis is the foundation for everything else.
Yeah.
Okay, so let's move on to treatment then. If a pet is diagnosed with cancer, what kind of approaches does the source talk about?
The source outlines several main strategies, and often they're using combination, depending on the specific cancer, the stage, the pet, all that. Surgery is frequently the first step for solid tumors, lumps you can remove. The goal is, ideally, to remove the entire mass with clean margins. If the cancer's caught early and hasn't spread, surgery alone can potentially be curative. Other times, maybe you can't get it all, but surgery can still help reduce the tumor size, what we call debulking, which might relieve pain or pressure and improve quality of life.
Okay, and then there's chemotherapy, which is probably the one most people think of with cancer treatment.
Yes, chemotherapy, using powerful drugs to kill or at least slow the growth of cancer cells. Because chemo drugs circulate through the whole body, it's often used for cancers that have spread or are likely to spread, or for cancers of the blood or lymph system like lymphoma. But what's really fascinating here, and so important for pet owners to understand, is how chemo is often used in veterinary medicine. The primary goal is frequently not an aggressive cure at all costs, like sometimes in human oncology. It's more often about prolonging life while preserving a good quality of life.
That's a really crucial distinction.
It is. The source notes that pets generally tolerate chemotherapy much better than humans often do. They typically experience fewer severe side effects, like, profound nausea or total hair loss. It can happen, but it's often less intense.
That's really important to know. It's not necessarily going to be the same intensely difficult experience that maybe a human patient goes through.
Often not as intense, no. Those side effects can still happen, of course, and they need to be managed carefully by the vet team.
Right. What other options are there?
Radiation therapy is another major one, using high-energy beams like X-rays precisely aimed to damage and destroy cancer cells in a specific area. It's particularly useful for tumors that maybe can't be fully removed with surgery or are located in difficult spots, like maybe in the head or pelvis.
Okay. And the source mentions some newer approaches too, right? More cutting-edge stuff.
It does, yeah, which really points to how fast this field is moving. Immunotherapy is a really exciting area. The idea is to harness the pet's own immune system to recognize and attack the cancer cells. It's still an emerging field in vet med, but there's some really promising developments happening. Targeted therapies too, drugs designed to attack specific molecules involved in cancer growth.
So a range of options, often used together.
Yeah.
What about if a cure just isn't possible, or maybe not the right choice for that pet?
Yeah, that's a really important scenario. And that's where palliative care or hospice care becomes the main focus. The goal shifts entirely then. It's about managing symptoms, controlling pain, making sure the animal is comfortable, and maintaining the best possible quality of life for whatever time they have left.
Okay.
Pain management is huge here, nutritional support, managing nausea, just keeping them happy and comfortable.
It's really about ensuring their remaining time is as good as it possibly can be. So with all these variables, the type of cancer, how far it spread, the pet's general health, the treatment chosen, what can pet owners realistically expect regarding the outcome? What's the prognosis typically like?
Yeah, the source is very clear on this. Prognosis varies hugely, massively. It depends entirely on all those factors you just listed. The specific type of cancer is critical. The stage at diagnosis, meaning how advanced it is, has it spread, that's huge. The pet's overall health and age also play a role, and of course, how well they respond to whatever treatment is chosen.
Could you give maybe a couple of examples from the source just to illustrate that wide range?
Sure. For instance, some cancers, like certain low-grade mast cell tumors on the skin that are removed completely with surgery, or maybe some forms of lymphoma caught very early, can respond really well to treatment. Pets might enjoy months or sometimes even years of excellent quality life with the right management.
Okay, so there can be really positive outcomes.
Definitely. But then on the other end of the spectrum, really aggressive cancers like hemangiosarcoma, which we mentioned, or osteosarcoma, the bone cancer, they often carry a much more guarded prognosis. That means the outlook is less certain, or the expected survival time might be shorter, maybe weeks or months, even with aggressive treatment.
That really highlights how essential that open, honest communication with the veterinary team is. They're the ones who can give you the specific picture for your pet.
Absolutely critical. Setting realistic expectations, understanding the options, the potential side effects, the costs, the goals of treatment. and working together to make informed decisions that always prioritize the pet's well-being and quality of life. That's vital.
We talked about risk factors earlier, like age and breed. But are there proactive steps pet owners can take when it comes to prevention and, maybe more realistically, early detection?
Yes, definitely. And this is where pet owners can feel, a bit more empowered. While we can't prevent every cancer, unfortunately, you can definitely take steps to reduce risk and significantly improve the chances of catching something early when treatment is often most effective.
Okay, like what?
Well, spaying and neutering, as we already touched on, that significantly reduces the risk of mammary tumors in females and testicular cancer in males. Huge preventative step for those types.
Right.
Routine veterinary exams are absolutely non-negotiable, cannot stress that enough, at least annually for younger pets, and ideally, the source suggests, maybe even biannually, twice a year for senior pets, say over 7 or 8 years old.
So those regular checkups aren't just for shots. They're really critical for catching things early.
Exactly. Your vet can pick up on subtle changes you might miss at home, slight weight loss, a new heart murmur, maybe feeling a small lump deep in the abdomen. Early detection is key.
Okay. What else?
Maintaining a healthy diet and a healthy weight is important too. Obesity is linked to chronic inflammation, and chronic inflammation is increasingly being linked as a risk factor for various cancers.
Good point.
And minimizing exposure to known environmental carcinogens where possible. Obvious one is don't smoke around your pets. Secondhand smoke is a risk factor. Maybe be mindful of certain lawn care chemicals, pesticides. Read labels, use safer alternatives if you can. Avoid excessive sun exposure for those light-colored cats prone to skin cancer.
Okay, those make sense. What about things we can be doing ourselves at home on a regular basis?
Yeah, the source strongly recommends regular home checks. Get hands-on with your pet. Pet owners should make it a routine maybe once a month while grooming or just cuddling to gently feel their pet's body all over. Get familiar with what feels normal for them. Feel for any new lumps, bumps, swelling under the skin. Check inside the mouth if they'll let you. Look for any sores that aren't healing, changes in skin color. Note the size, texture, and if anything seems to be growing or changing quickly. And report anything suspicious or persistent to your vet promptly. Don't wait.
Being really familiar with your pet's body and noticing changes, that hands-on approach is key.
It really is. You're the one who sees them every day.
It's clear this is, well, it's a lot for a pet owner to absorb, especially if they're facing a diagnosis. What does the source say about the emotional side of things?
It definitely highlights that. A cancer diagnosis in a beloved pet is, well, it's profoundly devastating for most people.
Yeah.
Our pets are family members, cherished companions, and seeing them ill affects us really deeply. Pet owners often have to navigate incredibly complex and difficult decisions, thinking about treatment options, managing the often significant costs involved, and potentially eventually making very difficult end-of-life care choices. It's emotionally draining. The source mentions that things like pet loss support groups, sometimes counseling, and crucially, clear, compassionate guidance from the veterinary team can be incredibly helpful during such a challenging time. You're not alone in this.
It really is a difficult journey that impacts the whole family unit, doesn't it?
Absolutely.
But there's also significant reason for hope, isn't there? The source touches quite a bit on the rapid advancements happening in veterinary oncology.
Yes. And this is really encouraging. This field is truly dynamic. It's moving incredibly fast. There are new diagnostic tools becoming available, more targeted therapies that zero in on cancer cells while sparing normal cells. There's a growing number of clinical trials investigating new treatments, just like in human medicine.
It's great.
Specialized veterinary oncologists exist now, vets who've done extra years of training just in cancer, and they often work closely with the general practice vets to create these really individualized treatment plans. Technologies like advanced imaging, CT, MRI, minimally invasive surgery techniques, even things like genomic testing of tumors to guide therapy. It's all changing the landscape. It allows for much more precise and potentially more effective care than was even possible just, 10 or 15 years ago.
That's incredibly encouraging to hear. It means the future likely holds even more possibilities, better ways to fight this disease for our pets.
Absolutely. What's really fascinating is just the sheer pace of innovation. It offers hope and options that, weren't even thinkable not that long ago.
Okay, so stepping back a bit now from this deep dive into understanding pet cancer, we've covered quite a lot of ground. We talked about what cancer actually is at a basic level, how surprisingly common it turns out to be, especially in older dogs.
The key risk factors like age, breed, environment.
Right. Some of the most frequent types we see in dogs and cats, those warning signs owners should watch for.
Uh-huh. And how vets go about diagnosing it, the exams, imaging, biopsies.
Then the range of treatment options, from surgery and chemo to radiation and newer therapies.
And what influences the prognosis, which varies so much.
And importantly, those vital steps for prevention and especially early detection that owners can take.
And we also touched on that significant emotional impact, but also, thankfully, the really exciting progress being made in veterinary oncology that offers new hope.
Yeah. So the core message, I think, distilled from this source material seems to be that, well, while a cancer diagnosis is undeniably challenging, frightening even, it is not always a death sentence, not automatically.
Definitely not.
Knowledge, taking those proactive steps for early detection, accessing good, skilled veterinary care, and leveraging these ongoing advancements. It all offers significant hope. Hope for managing pet cancer and, really importantly, maintaining a good quality of life for them for as long as possible.
And you, the pet owner, you are absolutely central to all of this. Being observant, recognizing those potential signs early, getting timely vet care, and being empowered with this kind of knowledge to have informed conversations and make those difficult decisions with your veterinary team. That's truly crucial to navigating this journey as effectively as possible.
It really puts the emphasis back on the pet owner's role, doesn't it, as their pet's primary advocate, their main health observer.
Absolutely. And, thinking about all this, especially the rapid advancements the source mentions, it does raise an interesting thought, maybe something for you, the listener, to consider. How might this accelerating progress in veterinary oncology continue to fundamentally change the landscape of pet cancer care in the coming years? What new possibilities might open up? And what does that evolving reality mean for the strength, maybe even the nature, of that human-animal bond we cherish so much?